Okay, go.
Okay. Hi, I'm Mrs. Hong,
I'm Mrs. Shivna. I'm the patient.
and we're going to be showing you a focused head-to-toe assessment that we will be expecting you to be able to perform at the beginning of your clinical rotations. Okay? So, you always know that you introduce yourself to the patient. We'll start from the beginning. As you walk out, before you knock on that door, you use your senses. You listen. Can you hear your patient breathing? No? That's good. Is your patient calling out for help? That's another key that could cause some concern. You also want to use your sense of smell. Is that nasty smell coming from your patient's room? So, you're going to go knock, 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 knock. As you walk in, you use your hand sanitizer. Hello, Mrs. Zhivna. My name is Donette, and I am the nursing student from Trocare College. I'm in my second semester, and I'm going to be taking your blood pressure and doing a focused head-to-toe assessment. Time out. You never want to say okay. If you say okay, the patient can say no, and then you're stuck. All right? So, Mrs. Zhivna, I'll be doing your blood pressure and a head-to-toe assessment. Mrs. Zhivna, can you please tell me your name and your birth date?
Okay, Linda Shivna.
And
I was born in 1950. Oh, I'm giving out a lot of information. November 21st.
Okay. And do you have? I see you have an allergy band on.
Yes, I have a problem with penicillin.
Okay. Very good. And what happens with your allergy with penicillin?
I got it once and I broke out in a rash.
Okay. Very good. So now I'm going to take your blood pressure, your temperature, and some vital signs that I need to take to make sure that you're doing well.
Oh, that's okay.
So first, you make sure you feel for your brachial artery minimally. Okay, you feel the pulse of your brachial artery, and you put on your blood pressure cuff the line that says artery mark over your brachial artery. You rest your hand down low so that it's comfortable, and your stethoscope. As you take your blood pressure, you pump it up till you can't hear it. Watch your dial. Okay? When you no longer hear it, pump it up 20 millimeters of mercury more and slowly release your blood pressure. Dial. Okay? Now, in report, you will have gotten what the patient's blood pressure is running, or from the EMR is another source. Okay? So from what you get, you need to compare it to what you already know. If it's much lower, you need to notify your mod leader and your nursing instructor. If it's much higher, that is also true. Please notify your nursing instructor and the mod leader. Now, as you've taken this blood pressure, you've assessed her skin. Is it warm and dry? Is it cool and clammy? Is it pink? Is it dusky? You can also check for her radial pulse. As you take her radial pulse, it's a good you count that for 1 minute. But after you've done it for a minute, you also don't release the pressure on the wrist. You want to count her respirations. Because what happens when you tell a patient or somebody you're going to count how many times they're breathing a minute? They change their rate. If we go back to the pulse, a normal pulse rate is between 60 and 100. Anything below 60 is bradycardic. Anything above 100 is tachycardia. You'll notify your instructor if these results are different from what you have found in your EMR. Okay. While you're here, you want to listen to the heart rate. All students take an apical rate. Okay. Fifth vital sign is going to be, you want to ask them if they have any pain. Where the pain is, what the pain is, using a pain scale from 1 to 10, 10 being the worst. What do they do to relieve the pain? What caused the pain? How long have they had the pain? Okay. This can also influence your blood pressure and your heart rate. So now as you go to take your apical heart rate, it's your fifth intercostal down, mid-clavicular. Okay? And you place the stethoscope using the diaphragm for an adult.
On the skin.
Right on the skin. I won't do that to Mrs. Zhibna right now. But this is what you'll do, okay? So it's always the diaphragm, the bigger part of your stethoscope. And you listen for 60 seconds. And you want to note the rate. Is it regular? Is it irregular? Okay? At this point in time, you're going to want to note if the patient is short of breath while they talk and do answer your questions. If they're short of breath, their respiratory rate will have been greater than 24. Are they dyspneic on exertion? Are they short of breath when they do things? Are they short of breath as they talk? That's always important assessments. With that respiratory status, if they are short of breath, you need to make sure you use your pulse ox. You place it on the index finger to get a reading. Some pulse oxes will not only give you the oxygen saturation, but also the heart rate. No cheating using the heart rate off the pulse ox. What's important to note, if your patient's fingers are cool, you may have difficulty getting that pulse ox. Okay, you may need to use another hand, or you may need to rub the patient's digits in yours to warm them up. Sometimes, yes, you may also use their earlobe. All right?
Now you can take your stethoscope.
Yes.
While it's still on your neck.
Very good. And assess for breath sounds. First, you'll start in the front. You can either start on the right or the left. 1, 2, 3, 4, 5, 6, 7, 8, 9. Think of when you do these, you're doing your rectangle assessment. You go from side to side, and then you go down, and then you go to the side and down. All right? Then have your patient lean forward. And on their skin, you start up here. You do your respiratory assessment. You start up here. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, and then over on the sides. Okay? Here you'll note whether they have crackles, rhonchi, wheezes, or normal breath sounds.
While you're listening to their breath sounds, we did it very quickly here. You ask them to take a breath through their nose, deep breath through their nose, and they should open their mouth and let the air out through their mouth. That's when you're going to best be able to hear your adventitious breath sounds. So again, we did it quickly. Instruct them to do that step by step.
Great. Then you, depending on what hospital you're at, some of them have the thermometers that go under the tongue. Some of them go into the ear. They're tympanic. Or if your patient's in isolation, you may have the tempodots that will go across the forehead. Okay. Again.
Or under the tongue.
Or under the tongue. Okay. So now you've done a basic assessment here. You wanted to, hopefully your patient, Mrs. Zhibna, has been very good. She's been